our working groups, also known as the hub communities, have voted last year on an annual theme, which is global mental health and well-being, to promote cross-cutting collaboration between the communities and also to develop a joint product, the paper that you have written. And you, as the global mental health community, have then taken on this process to draft the paper. And Michael, as the manager of the community, I would really like to know from you what motivated you personally to invest time and effort in engaging this group and also all the communities really in writing this paper.
Well, thank you, Merle. Mental health is global. It's a truly worldwide phenomenon, almost a symptom for too rapid changes of culture and living conditions. And we in Germany, or I as a German, I feel a specific obligation as we are favoring one of the most advanced mental health systems worldwide.
Who should read your paper and why, Isabella?
So everyone should read it, of course. The paper is directed at policymakers, physicians, the health workforce, scientists, civil societies, and of course, patients themselves. So we have conceptualized the paper to be relevant to all these different stakeholders groups. And why should they read it? Because it's a great paper. We put a lot of effort in developing a truly integrated paper that reflects various perspectives on mental health, from child and women's health to flight and migration to urban health and climate change, and all this in connection with NCDs. Thus, it will provide the reader with many insights on the overarching relevance of mental health on other global health issues.
Thank you. Solveig, what do you hope will change as a result of the paper?
Yes, so we really hope that this paper will raise awareness around global mental health, which is not only since the COVID pandemic an increasingly visible topic, and as a paper which is informed by the input of specialists from many different sectors of global health in Germany, we hope to give good insight into the cross-cutting relevance of mental health. So we formulated specific key messages and recommendations, and we hope this will guide the design of more cross-cutting interventions to improve global mental health and consequently health in general.
Great, thank you. And Michael, it was your idea actually to bring the communities together. Why do you think it's important for our working groups, the hub communities, to collaborate on an annual theme as we did last year?
Well, being in the hub from the beginning on, I was astonished how much, even in the Global Health Hub, we tend to work and to think in specific silos. And in mental health, this is especially difficult as it requires a systemic perspective, because in mental health, we always have these constant interactions, interrelations of biological, psychological, social factors. And we have overcome it a little bit by working together on this topic, together on one specific topic. Thank you.
Absolutely. And yeah, that's true. And Solveig, there were some challenges along the way. Can you tell me what were the major challenges and how did you overcome them as in writing this paper?
So as Michael and Isabella already mentioned before, the Global Health Hub is a multi-sectoral network that connects various stakeholders in various sectors in the field of global health. And there were a lot of different communities involved in the consultation process of this paper. So really the main challenge was to break down the input of all of these different groups and condense the information we received and to kind of clearly formulate the synergies with a common denominator being global mental health. So there were several things that helped us overcome these boundaries. What was most helpful was that we had a really fruitful and active exchange, not only inside the Global Mental Health Working Group, but also with the other hub communities, we had a webinar where we could discuss in person the different topics and the different discussion points. In my opinion, it really demonstrated how relevant it is to have a forum like the Global Health Hub to discuss these issues between the different sectors.
That's great to hear. Isabella, what are your key lessons learned from this process?
So one very important learning was definitely communicate clear deadlines. But besides that, I learned that developing a holistic and truly cross-cutting paper on mental health implies simply a lot of work. And if you want to do it right and actually get an exchange with other communities, yeah, you need time to do that. And so we were more than happy that the Global Health Hub helped us to write this paper, and truly it would not have been possible without them to have all the relevant actors on board. So it was a great opportunity, as Michael said, to have this annual theme, which was elected by all communities. So thus we knew that all communities have a high interest in the topic and also have a commitment to contribute to this paper. So yeah, I'm very much looking forward to the upcoming annual theme, and I'm excited to see what the plans are for this year.
Great, thank you. Michael, now what are the next steps for the global mental health community after this huge project? And who would you like to see participate in the next meetings and your next activities?
Yeah, I think the next milestone is the Global Health Hub talk and the community meetings in Berlin, mid of June, 12th and 13th of June. And what we have learned so much is the importance of vulnerability and risk factors. And we like migration or urbanization or poverty or so. And what we like to start now is to go from thinking to action, so to say. This means that we will look into, together with other colleagues who hopefully help us and join us, to look into possibilities of prevention and intervention, very basic interventions applicable in North and South in very affluent and very poor countries, like the WHO PM+ program. This will be one of our key issues. But of course, I have to negotiate with all my other community members, but I think we will go along this line. Thank you very much.
That's wonderful. Of course, we will be there to support you along the way. And at this point, I would really like to thank all of you in particular for having put time and effort into this process, and the whole global mental health community, of course, for driving this process. I would also like to thank all the communities who participated, the individuals who commented on the paper, and also United for Global Mental Health, who also took their time to support us along this way.